no two cancers are the same. No matter how different, each cancer facility at St. Luke's exhibits the same kind of vigilance in trying to win the war over this disease. In fact, one center is dedicated to battle brain cancer. Welcome to St. Luke's Comprehensive Brain Tumor Center.
When a patient comes with a brain tumor, it's basically a bad disease. So you have to be able to give the patient the best possible care. So what the patient needs is a comprehensive approach. You need input from everybody. So you want input from neurosurgeons, from neuro-oncologists, and radiation oncologists, and others. So basically what you want is come up with a treatment that's going to offer the best possible outcome for that particular patient.
The Brain Tumor Center is very different in that it specifically treats patients with brain cancers, and they are different in that the neurological symptoms are more manifest than the systemic symptoms. So those are things that are not seen in other cancer patients, such as seizures, increased intracranial pressure, disability, like patients who, they look like patients who have suffered from a stroke. So the neurological management is paramount.
The expertise of St. Luke's Comprehensive Brain Tumor Center lies in its highly skilled medical staff. With a strong team behind its day-to-day operations, the Comprehensive Brain Tumor Center is proud to offer the following services. Neuro-oncology consultation.
Usually, for a neuro-oncology consult, the patients are referred to the Brain Tumor Center, either to a specific neuro-oncologist or for a multidisciplinary consult. If it's a neuro-oncology consult, then the patient is seen by us. We do the history, we do the physical examination as well as the neurologic exam. We look at all the films that the patient has brought with them. There has been nothing done so far, then we start from the beginning and we request all the tests. If it's a clear-cut case, then usually we go on and treat the patient with standard treatment because it is faster that way. Because every case is different, we call the tumor board and we talk about what the best strategy is for the patient.
Multidisciplinary tumor board consultation is a service where a patient's case is discussed by the brain tumor team, after which the best possible options are offered to the patient and the family. Chemotherapy.
So we have therapies which are proven 100%, which are called standard chemotherapy used internationally. And we have all of those, such as the treatment for glioblastoma, which is both radiation and chemotherapy, treatments for primary CNS lymphoma using high-dose methotrexate, which is giving chemotherapy 300 times the usual dose in a safe way.
Neurosurgery.
Image-guided neurosurgery is a form of surgery wherein we use the images of the brain, like the MRI, CT scan, angiogram, and ultrasound, and to use as a map going into the site of the tumor so that we can take out the lesion safely and in a more accurate way. Endoscopic craniotomy is a form of surgery wherein we use the endoscope to visualize the tumor, and usually this is reserved for tumors inside the ventricular system or the ventricles, wherein there's a lot of space to move around and take out the tumor. Endovascular embolization is a way of treating tumors wherein we pass through the blood vessels, through the femoral artery, to obliterate the tumor by giving materials that will obliterate the tumor. Okay. So you remove the blood supply of the tumor, and thereby the tumor will die off.
So awake craniotomy is basically doing a surgery in a patient, and he is awake for a certain period of time. There's no tube in the mouth, but he is asleep. And then while we open the patient, he's sleeping, and then once we are in the tumor, then we wake the patient up. And then we start doing the surgery. At the same time, the speech pathologist is talking to the patient. In that way, you're able to preserve the speech function of the patient, at the same time able to maximize your tumor removal.
Radiation and imaging.
WBRT, or whole brain radiation therapy, is a way of delivering radiation wherein we include all parts of the brain. So it involves the whole field to be able to include not only the tumor but the rest of the parts of the brain. In this way, we are able to treat the tumor and prevent whatever possible growing tumors in the other areas of the brain. So IMRT, or intensity modulated radiation therapy, is a form of giving radiation or delivering radiation in a three-dimensional radiation treatment. In that way, we can be more precise to the target, which is the tumor, and be able to kill the tumor and yet spare the normal surrounding structures from unnecessary radiation. Stereotactic radiosurgery, or SRS, is a form of giving radiation therapy in a three-dimensional way wherein it involves a team, a multidisciplinary team consisting of the radiation oncologist, the neurosurgeon, the medical physicist, and the other attending doctors such as the neuro-oncologist. This way of giving radiation is very precise, and it entails one-time delivery of high-dose radiation to the tumor.
The Comprehensive Brain Tumor Center puts equal weight to aftercare. In addition to these diagnostic and therapeutic medical services, the center also offers psychiatric liaison for patient and family support. Rehabilitation is also provided, as the center recognizes this as an important part in a patient's recovery. With the Comprehensive Brain Tumor Center, patients with brain cancer are presented with smarter choices for the management of their disease. Visit St. Luke's Comprehensive Brain Tumor Center and discover how our expertise will help you battle brain cancer head-on. St. Luke's Comprehensive Brain Tumor Center, the expert in brain cancer care. Ultimately, it is expertise.